Well, good morning, and thank you all for joining us today. This morning I'm joined by Baltimore County Fire Chief Joanne Rund, as well as IAFF Local 1311 President John Sabiga. Throughout our county, our state, and right here in Baltimore County, we are continuing to see unprecedented numbers of COVID-19 cases as the Omicron variant spreads exponentially. Over just the past month, Baltimore County's average positivity rate has increased 400%. The average number of hospitalized COVID patients in Baltimore County has increased over 300%. And statewide, daily cases are now up over 500%. We've continued to hear from our hospital leaders in the region about the dire situation we are facing. Emergency departments are full, and hospitals and ICUs are overwhelmed. More people in Maryland are now hospitalized with COVID than ever before, and there are just 8 staffed ICU beds currently available. We expect that this may only continue to worsen. Just this week, some of Maryland's hospitals, including St. Joseph Medical Center here in Baltimore County, have shifted to crisis mode to ease some of the burdens on doctors and nurses. Yesterday, I toured GBMC, visited a Baltimore County testing site and a few of Baltimore County's fire stations to see firsthand what they are experiencing. When I visited GBMC, one story in particular struck me. A health professional there shared that a staff member was berated when providing a COVID test. A patient was irate that they couldn't get a result in 15 minutes and had to wait for a result. So much so that they had to call security in. And these are for health professionals who are giving their all. It was pretty staggering to me to hear some of the things that our healthcare professionals and first responders are dealing with out there. So today I'm calling first for kindness towards those who are serving us, because our healthcare workers and first responders are working around the clock, and they're tired, they're exhausted, and yet I am in awe of what I saw firsthand yesterday. Their incredible resilience and their commitment and resolve to doing all that they can to save lives. I want to thank them for their heroic efforts and let them know that we will continue to do whatever we can to have their backs. While we have seen that this highly contagious variant has been shown to be severe for unvaccinated individuals, it has been less severe for those who are vaccinated. And I'm happy to report personally that being vaccinated and especially being boosted really helps in our fight against COVID. Because despite knowing this fact, just a fraction of our population, according to data statewide, 74% of those who are in hospitals are unvaccinated. Only 24% of those are vaccinated, and a mere 2%, only 2% of individuals who are boosted represent our hospital census today. Those who choose to remain unvaccinated, to be clear, are driving this staggering increase in hospitalizations. I think that's worth repeating. Those who choose to remain unvaccinated are driving this staggering increase in hospitalizations. And as a result of that, we're also seeing an unprecedented burden on our emergency services. Chief Rund and President Sabiga will talk a little bit more about how that's affecting both the EMS services and our fire department more generally. So in response to this current situation, upon the advice of our health professionals, we reinstituted a state of emergency in Baltimore County and issued an indoor mask requirement in public spaces. I want to thank the Baltimore County Council for their recent vote, a bipartisan vote, to support these latest public health actions earlier this week. Because we need to put aside ideology, put aside party, to do our part and protect our community this winter. As Governor Hogan has said, the next few weeks of this crisis will likely be the most difficult we've experienced throughout. And again, we know the best way to protect ourselves and our loved ones and to fight the spread is to get vaccinated and to get boosted. Over 600,000 residents in Baltimore County are vaccinated. That's roughly 73% of our population. And to those residents, I say thank you. For those who aren't, we have clinics available for all individuals 5 and up. Boosters remain available for residents 16 and over. And following the news from the FDA, we are prepared to expand our efforts for boosters for 12 to 15-year-olds. So again, first and foremost, it's a plea. If you have not been vaccinated, get vaccinated. If you have not been boosted and you're eligible, get boosted. Do it now. Stay out of the hospital. Protect yourself and your family, because this isn't just about you. It's about every single person who needs an ambulance, every person who needs a hospital bed, every person who has to go to work or send their child to school. It's up to all of us to do our part. On testing, we've already made thousands of tests available at our health centers and public library branches, and we're also helping to provide 125,000 tests and tens of thousands of KN95 masks directly to BCPS to support their operations, especially timely as they resume operations today. However, across our state, we continue to see long lines of those who want to get tested. We even saw people out in the middle of a snowstorm waiting to get tested this week. So to improve the experience for our residents, today we're announcing our latest efforts to expand testing operations. First, to support overall capacity, Baltimore County will be opening our large-scale testing site at the former Sears location at the White Marsh Mall. This site will open this upcoming Monday and will complement Baltimore County's existing testing sites in Randallstown, Towson, and Dundalk. In addition, we are extending the hours of our existing sites and exploring a weekend option. More information on these sites and precise times will be available on the county's website later this week. You can visit baltimorecountymd.gov/COVID test to learn more. In addition, because of the incredible demand that we're seeing, in order to help limit wait times out of care for both the public and our employees, especially in potential severe weather conditions, next week Baltimore County will be moving to appointment-only testing at all of our testing clinics. Beginning later this week, residents can visit the county's website, again, baltimorecountymd.gov/COVID test, or call our county's COVID hotline, 410-887-3816, to make an appointment. And finally, Baltimore County has purchased, using our state of emergency procurement, we've purchased 100,000 at-home test kits to provide directly to our residents. We expect delivery of the first batch of these kits in the coming days, and we will make sure that these are equitably available to all residents at locations throughout Baltimore County, also beginning this Monday. We will provide locations and times where residents can secure these tests before that distribution begins. Bottom line is this: we need to do whatever we can to keep our health care and our emergency response systems from being overwhelmed, so that we can keep our kids in school and protect our most vulnerable. So please, do your part so that we can get through this together. Get vaccinated, get boosted, wear your mask, use common sense, be a good neighbor, and care for each other. That's the only way we'll get through this. With that, I'll turn things over to Chief Rund.
Thank you, Mr. County Executive. I would like to thank our County Executive, along with our Health Department and our other partners, during this unprecedented event. As Chief, your most important resource is your personnel. I want to personally thank all of our personnel, our emergency responders, especially our EMTs and paramedics who are out there every single day. They have been on the front lines for the past 2 years. They are tired and they are exhausted. It is physically and it is emotionally tolling on them. Please be kind. They're going to be kind, and they're going to come, and they're going to save you, and they're going to help you, and they're going to work with you and take care of you. Please be kind when they come and see you. They are doing their best to get you the care that they need. The Omicron wave has stressed our regional EMS system to its max. Local as well as EMS providers are doing their best to keep up with it. The Baltimore County Fire Department is dealing with several factors. We're dealing with the increase in patients calling for 911. We are dealing with our own personnel becoming infected and needing help. And the fact that emergency medical units are maxed to the top, and they're getting on the road as fast as they can and taking care of the patients as fast as they can. But you have to know that our hospital providers are also told in their texts. This causes longer emergency room waits. Use the COVID guidelines to determine whether or not you need to go to the hospital. Call 911 if you have an emergency, if it is a true emergency. Because our EMS units are so busy, we've taken a number of steps to augment our system. We are constantly monitoring EMS to vans by putting EMS personnel, management personnel, on staff to monitor the call volumes every day, all day. We are also converting specialized units if we need to be full-time medic units if they need to be. In response to the social media post about being out of transport units, our transport units are on the road, they're transporting to the hospital, and there are times when a fire engine, a brush truck, or another unit may show up to your home or wherever you are where you need medical care. Those personnel are also trained in emergency medical services. They are not just firefighters. So please know we will get you help if you need it. It is highly unusual to see a piece of equipment other than an ambulance pull up if you call for a medical call, but there are times where that may happen. Please know that these personnel that show up have the resources that they need to assist you. We know people are surprised sometimes when they see a fire truck pull up and not an ambulance. It's okay. They're trained to take care of you. For questions regarding to your COVID symptoms, please go to the COVID website that the county has provided you so that you can get the resources that you need for that. Please know that we are here to help you and we will provide service if there is service needed. Thank you very much. And now I'll let you hear from President Sabiga.
Good morning. I represent over 1,100 members, EMS, paramedics, and firefighters that have been on the front lines that the County Executive and Chief Rund has spoken about. We thank County Executive as well as Chief Rund and her command staff for being able to upstaff additional units. That funding is critical to keeping those units on the street. Our units are incredibly taxed at this time. We are running at capacity and beyond. Our paramedics, our firefighters, our EMTs are working in excess of 24, 36, and some even 40 hours. It's tough out there. There's an extended wait time in the emergency room. For minor injuries, you may be sitting in an emergency room for 23, 24 hours straight with no end in sight. There is a backlog. There is a critical need for beds throughout the hospital system in Baltimore County. We're fortunate, though, we have a great system in place that is able to handle any additional call volumes. We're fortunate that the men and women that serve every day do this tirelessly and without sometimes extended gratitudes. We're very thankful for the patients that we understand need our help. We understand that there is a distinct need for those folks to be there, and we will be there to handle the call volume as necessary. Thank you.
Thank you, Chief. Thank you, President Sabiga. Happy to take any questions before we wrap today. Okay, yeah.
Sorry, I have a couple questions, but first, because we're talking about EMS staffing.
Sure.
How short is your workforce right now in terms of EMS, paramedics? You can't give specific numbers, percentages would be helpful.
So we have about 10% of our workforce, roughly, that is out right now due to being quarantined or having COVID themselves.
And on the testing front, if you don't mind, what is your practice procedure? I was going to ask you the way you like this. How many tests an hour do you think you'll be able to do at between the new site and the Sears and the other testing sites? What's your goal to get county residents tested from that site?
So we do have Elin here from the Health Department who can help us out here on that as well.
Have you heard that the state's going to stand up one of their new clinics here in the county? So curious about the goal for testing.
We're not sure yet where those sites will be from the state, but we are able to do a throughput time of 4.5 minutes per person for testing. That's how long it takes each individual to be tested. And we have set hours for those testing schedules. So we do that math, and that's how much we're able to do. giving 4.5 minutes per each person.
What was the decision in changing it from walk-up to appointment? Is that based on the amount of tests? Is that based on availability? What's the decision?
A lot of it really is about the wellness of our staff and the public. What we're seeing is you've got members of the public, some who have respiratory and other illnesses, standing outside in the cold for hours at a time. And that's really not to the benefit of them, nor is it to the benefit of our staff. So in terms of managing lines better, having people have some better consistency, not seeing people have to stand here or anywhere else, wait for an hour or more to be told that we're out of tests, or we have to stop to make sure that the samples get to the lab in time. This is a way to ensure that those who are, in fact, signed up actually get the testing that they need. It's our hope that in addition to the expanded testing at White Marsh that starts next week, that we'll be pushing out tens of thousands of rapid tests for free to the public, which should also help alleviate some of the burdens that our testing sites are currently experiencing. And to the point that the Chief and President Zabiga mentioned, this is really about telling the public, please don't use our medic units in the hospital EDs for testing. That's not what they're there for. We're going to make sure we expand testing as much as we have to meet the demand. We're going to keep working with Governor Hogan and the state. We're going to welcome whatever support they give. We're going to do our additional resources here. But this is about meeting the testing demand and trying to remind folks that EMS and EMT services and the hospitals are not places for tests.
What have been your conversations with the school system in Baltimore County about kids remaining in school? There seems to be a full-throated endorsement from a lot of folks around the region about keeping kids in school and having the tests. What have been your conversations about that for parents who are concerned, who don't want to send their kids to school because they're afraid they're going to get COVID?
Sure. So what I can say is, as a parent of a kindergartner of a BCPS student, as a former BCPS teacher, and in this role, I believe that our kids belong in schools and that we remain fully committed to doing everything that we can to support our school system to remain safe. We have provided over 70,000 KN95 masks. They gave delivery of those to the school system over the weekend, so they had those in advance, well in advance of opening this week. We gave them 1,000 test kits earlier over the weekend as well to test any staff or students who are symptomatic. We believe that once we have our additional shipments, we'll be giving them more of our test kits to get through this week. We've also, again, used our emergency procurement to partner with them. We've procured over 100,000 rapid tests specifically for the school system on top of the test kits that we'll be giving out to the general public. So we are confident that and that's on top of the $19 million we spent under the CARES funding to do things like improve air quality and filtration. We have a lot of filters in our school system from that initial purchase, but we'll continue to do whatever we can, partnering with the school system and our teachers and staff.
And one final question about
Sure.
staffing for the police department. I know it's about 10% for the fire department. As far as the police department's concerned, what's the percentage of staff that's not working now because of COVID and because of quarantine issues?
My guess is probably going to be pretty similar across most public safety departments. We're experiencing challenges in fire and police and corrections because this is a very contagious disease, and as folks get it, we're asking them to follow the guidance. Staffing is the other challenge with schools. I mean, we're going to see, because of the inability to staff our schools appropriately, that the school system in Baltimore County has already had to make some decisions, not necessarily from a public health perspective, but from just a staffing perspective, to have to close either individual grades or entire buildings. So we're going to continue to adjust and adapt. The chief has done a great job managing her staff members. We've authorized, as she mentioned, additional service. We've authorized additional callback time to make sure that as we have folks who are uneligible to work, that we are providing sufficient resources to have people on the job. Jeff?
Yesterday in Howard County, they announced Allied Health was going to help set aside stuff for essential tests for essential workers, county workers. Their fear there was people coming back from the holidays. They didn't want them having to fight to try to find a test.
Yep.
And maybe come up empty. Is there something going on here in Baltimore County that helps those essential workers make sure they can't?
Absolutely. So in addition to using some of the rapid tests that we're going to make available to the public to make available to our employees, We also will be using our test vendor for the testing we're already doing to set up a separate clinic for any employee who wants to have testing. That will be an additional option for county employees so that they don't have to go out and seek additional tests on their own. So we absolutely will be doing that in the days ahead and hope to have that information to our employees soon. Great. Thanks, everybody.